Marty, there's a new health center opening up in our area focusing on improving diet, physical activity, sleep, stress, and so much more. We're taking a closer look at the new Family and Lifestyle Medicine Center in Canandaigua. We're joined by Dr. Kerry Graff. She is a certified lifestyle medicine provider at Rochester Regional Health. And it's wonderful to have you with us, Dr. Graff. Thanks for joining us.
Oh, it's a pleasure to be here.
So, you know, we're so used to going to a doctor and being told, okay, if you have high blood pressure, if you have, you know, any kind of condition, here's your medicine, I'll see you in, you know, 3 or 4 months or whatever. You're saying, let's take a different approach to our health, right?
Yes. Sometimes pills are necessary, absolutely, but about 80% of our health is really in our own control. It's based on what we eat, how much physical activity we have, whether we smoke, and if you change those things, you can reverse the disease like high blood pressure or diabetes, heart disease. All of those things can be reversible through changing lifestyle.
When you talk about lifestyle, the Centers for Disease Control estimates 80% of health problems in the U.S. are caused by lifestyle patterns. That's incredible. 80% of our problems caused by our lifestyle.
Yeah.
We're talking diet, smoking, and not moving.
Right.
That's incredible.
Yeah. In lifestyle medicine, we like to think of those as fingers, forks, and feet, right? So fingers for smoking, forks for what you're eating, and feet for physical activity.
That's great.
There are 3 other ones that also impact that. They have some impact directly, but they also have a big impact on your ability to do those first 3. There's sleep, stress, and love. So when I do an initial evaluation on somebody for lifestyle medicine, we always look at all 6 of those things. And in fact, the most important one, the one that I never let anybody leave my office until we've really talked about, is love. That basically what motivates you, what is worth being alive for. Because if you've got somebody who doesn't have this passion for something in life that they want to take care of their health for, they're not going to do any of those healthy behaviors. And a lot of the folks who see me for a first-time consult, they come in because they're afraid. They come in because they just had a heart attack, they just got diagnosed with diabetes, somebody in their family just died from something that is hereditary, but there might also be a lifestyle component to that. And fear is a terrible motivator, but it's what, as physicians, we end up, we are kind of trained almost to freak out our patients by how significant this problem is and that they need to make sure they get it treated. But in reality, fear only motivates you for a couple of months. And then you either have to, you motivate yourself every day by worrying about bad things happening to you. So you either get so anxious or depressed that you have to stick your head in the sand, or you just stop losing your zest for living. So we always focus, one hard and fast rule is that nobody leaves my office from that first visit until we kind of figure out what makes their life worth living and get that at the front. Because otherwise, anything else I do doesn't really matter.
So you answered my question about how people would find you. How, would you be in addition to their already, to the other doctors they see for their condition?
Yes, so I'm also a family medicine physician, and I have my own group of patients that I take care of kind of everything for. And I do lifestyle medicine with those patients, but I do a consult service as well. Is
this expanding in the world of medicine? Are we going to see more lifestyle doctors?
Yeah, absolutely. There are about 500 of them on the whole planet right now. It's a fairly new specialty. And really, Rochester Regional Health is really doing a wonderful thing, I think, in terms of kind of putting this in a different perspective. So most of the places that are doing lifestyle medicine, they will do like a big center that's kind of in the center of town and have everybody referred in. Rochester Regional has taken a different tactic, which is more trying to train the primary care docs who are already in the community to know more about this and to incorporate that also into their practices. And for the ones who really love it, which a lot of them do, because once you start doing it, like it's the best thing ever.
Oh, it's great.
That they can also do consults for the other docs who aren't, to really help to move this model forward.
This, Dr. Graff, is a kind of doctor you may be seeing soon. And I love that question. What do you love? What motivates you? Because that can be a big determinant in how you take care of yourself. I love that. Fear versus love, right? I like that. Dr. Graff, thank you so much for joining us. You're in Canandaigua.
Yes.
Of course, if people have more questions, you can go online. Rochester Regional Health, I'm sure, has more information there. Great to meet you, Doctor.
Nice to meet you, too. Thanks for having me.
Thanks for what you do.
I love it.
I love